Good morning, senior colleagues. My name is Adejimobi Sekinat, an house officer in the endocrinology and diabetes unit of the Baghdad General Hospital, and I'll be presenting this study titled Determinants of Antidiabetic Agent Adherence among patients attending a secondary healthcare facility in Lagos. These are the co-authors. I'll be going by this outline. So as we all know, glycemic control is one of the main foundations in the management of diabetes. And for patients with diabetes to get the maximum benefit from their health care, from the management, from their drugs, they have to make sure that they adhere to these medications. Adherence is defined by the WHO as the extent to which a person's behavior is in tandem or corresponds with the agreed recommendations by an healthcare provider. This behavior could be medication use, could be diet, could be any form of lifestyle change. Average adherence to long-term therapy in developing countries is only about 50%, while in developed countries is only about 50%, while in developing countries we find it is much lower. Poor medication adherence leads to worsening of the disease, and as a result can pose huge financial burden on the patient and the healthcare system. It could also cause increased morbidity and mortality for those patients. This study was designed to determine the level of adherence amongst the patients attending our diabetes clinic and to evaluate the determinants of this adherence among same patients. It's a cross-sectional study recruiting about 231 consenting adults. Information on their social demographics, anthropometry, HbA1c, and medication adherence were collected. The Morisky medication adherence score, an ATAD self-reported tool, was used to assess adherence in these patients and used to divide them into patients with high adherence, patients with medium adherence, and patients with low adherence. In this study, we find that 67.5%, about 2/3 of our patients are women, and about 97.4% of them have type 2 diabetes. Mean age amongst our patients was 59.81, meaning that most of our patients were in their 5th and 6th decades of life. The mean adherence score in this study was 5.80. The mean cost of medications was about 18,605 naira. The mean HbA1c was 9.12. And about 25.1% had good glycemic control, and with 47.2, a whooping 47.2 of them having low adherence scores. Amongst patients with type 1 DM, the mean HbA1c was found to be about 12.78, meaning that people with type 1 diabetes had a higher mean HbA1c compared to the general population, and none of them had high adherence. This bar chart is a way to visually describe the differences between adherence scores in patients with type 1 DM and patients with type 2 DM. And you can see that patients with type 1 DM had no patients with high adherence, and about 66.7% of them, it's about 2/3 of them, had low adherence scores, compared to 46.7% among patients with type 2 DM. This chart describes HbA1c, stratifies HbA1c based on the level of adherence of these patients. And we find that patients with low adherence had an average HbA1c of 10, while those with high adherence had an average HbA1c of 7.07, which is very close to our target in this study, which was less than 7. Adherence was positively correlated with age, income, cost of medications, and the total number of medications the patients were on. While HbA1c was negatively correlated. There was no significant relationship between sex, age, sex, level of education, and duration of diabetes with the adherence of these patients. Almost half of our patients, about 47.2%, had poor adherence, which is significantly higher than the one reported by Federer et al. At about 26.6%. The poor level of adherence in this study was strongly linked to poor glycemic control, and paradoxically, we find that adherence was increasing with cost of medications, which contrasts strongly with the existing literature. This is probably because patients don't want to waste their money, and when they spend more money, they want to use their drugs. Younger patients and those in lower socioeconomic classes have also been found to have poor adherence and as a result have poor glycemic control. Adherence was worse amongst the patients with type 1 DM compared to those with type 2 DM. This is possibly because the people with type 1 DM were found to be younger, and it could also be because they are on insulin, which is injectable and not very comfortable to use. In conclusion, the glycemic control in this cohort was poor generally and was strongly linked to low adherence, which can negatively affect their morbidity, mortality, and their quality of life. Young subjects and those with type 1 DM are poorly adherent and as a result have poor glycemic control, and this is a ticking time bomb because if concerted efforts are not made to correct this in these patients, we are looking at poorer morbidity and a higher chance of complications in future. Contrarily, the level of adherence increased with higher cost of medications and total pill burden. In this study, I guess we found out that our patients like using their drugs. These are my references. Thank you.